One of the peacetime uses of atomic energy is the detection of human abnormalities through the use of radioisotopes. This is being done in the field of nuclear medicine. Radioactive drugs are prepared in a specially designed glove box to prevent excessive exposure to radiation. Radioactive isotopes are mixed with certain drugs, then measured in a dose calibrator. Before testing begins, the patient is given this drug either orally or intravenously. These sources of radiant energy disseminate throughout the body.
This particular piece of equipment is what we call a total body scanner, in which we scan the patient from the top of the head to the toes. And we do this for bone scanning, looking for the spread of tumors. We look at various kinds of fractures, whether they are new or old. We can look at infection in bone, sometimes before it can even be seen on the x-ray.
The scanner moves back and forth over the areas of interest, and electronic impulses are transformed into a dot pattern onto a film.
To find things on x-rays, you frequently have to have about 30 to 50% demineralization of the bone. It doesn't show up as much on the x-rays in one area as it does on another. But before that can occur, we can find it with bone scans so that you can start treatment that much earlier, sometimes weeks earlier, months earlier. Particularly, this is important in patients who have tumors that have spread to bone, and you want to treat them before they get a collapse of the bone or something like that.
60% of the nuclear testing is used to detect the presence and location of cancer.
This is a total body scan taken on 2 pieces of x-ray film, and it is the result of the procedure we showed you in the dual probe room. It is a bone scan, and you see the arms, the spine, the head, and the pelvis or the hip bones here. And there is an abnormality here, but also there is an abnormality in the bone. We're looking for a darker spot than usual. And you see we have a dark spot here, a dark spot here, and here, and here, and this is metastatic carcinoma from carcinoma of the lung.
When the patient came down, you knew already that he had lung cancer, is that correct?
Yes.
You were trying to see if it had metastasized.
She was also probably having bone pain.
This patient is having a brain scan. A radioisotope has collected in the head.
Little gamma rays, the photons that escape from the patient's head, go into what we call a crystal, which is covered with a little aluminum can there. And then, through a process, they're converted into light flashes.
An abnormal accumulation of gamma rays signals a problem area.
Perhaps a patient has had a fall or has been in an automobile accident and has central nervous system symptoms which lead the doctor to suspect that he has a collection of blood under the skull. We also look for cerebral hemorrhage, brain abscesses, meningitis, and other things.
When the examination is completed, scans are reviewed, correlated with x-rays, and an opinion of the disease process or lack of it is written. These scanners are far more sensitive than x-rays, permitting greater accuracy and detail, and improving patient care through better diagnosis.